To work in my afternoons. Thinking about the sun setting, right? So we're just going to pause for just a minute here. And hello. So are you guys good? Okay. So we're going to get started in just a minute. Let me just go ahead and do an overview, and so folks know. Basically, so we are going to do our traditional COVID update run of show, and we're going to feature a couple of folks today. Number one, our Fire Marshal, Gene Gallegos. He's going to talk a lot about compliance. Then, of course, Dr. Mark DeMena is going to join us to talk about where we're at in terms of Metro Albuquerque, and a little bit about then what's happening with respect to our safety net and homeless folks or unhoused folks. And our director, Carol Pierce, is going to be speaking about that topic. Then we're also going to hear from a wonderful community member, Enrique Cardiel, who's going to talk also about PPE for the homeless, some of the work that his organization has been doing. In general, want to remind everyone that this is really day 2 of our reset, and both under the city health order and the state health order. And for us, this is really yet another defining moment in this pandemic. Just like the first time we went through this and over the summer when we went through it, our focus at the city is to make sure that we have essential services operating that you rely on. It also means that we've got to keep the city safety net continuing to function. We're going to talk about the different closures at the city. We're going to talk about what's also open and so forth. But again, a big dividing line is how can we help small businesses? How can we continue to provide childcare for essential workers and those who need it, especially because we understand that staying home is a luxury. And in many ways, there are a lot of workers that either have to go to work or there's no real other choice for them economically, or because they might be in a single parent situation. There's also seniors, so we got to continue to provide those senior meals. I think we're over 500,000. We'll give a little bit of an update on that. And we also know that we have to continue to take care of our most vulnerable, whether it's helping folks through our emergency health centers with things like food boxes and emergency clothing and rental assistance to prevent eviction. And also things even around making sure that 311 continues to operate, making sure our bus system continues to operate even though in a limited capacity. So we're going to go through all of those adjustments today, and we're going to talk about also, we're going to preview a little bit about some decisions we need to make going into the holidays. We'll focus next week's update primarily on Thanksgiving through the holidays. So a little bit about helping small business. City Council and the administration, we work together, and we are in the midst of distributing $10 million to small businesses. And we've been able to do that at, I think, a very efficient pace. It took us, I think, about 4 to 6 weeks to get that program up and running. Take the applications, and last Friday, just a few days ago, we started handing out the initial checks. So a third of that funding is already out the door. And I know we actually we gave funding to 97 businesses, and it's an amazing sight to see. We have folks, it's a drive-up pickup because people all said they wanted the check right away. They didn't even want to wait for mail. And, we go through the compliance, make sure they're who they say they are and all of those things, and then we are literally handing checks through the car window. It is just one of those visuals, I think, of these times, these different times, and what it means in a pandemic to support small businesses. Oddly, it's come to literally handing checks to people in their cars. But everyone is extremely grateful. There was a line of about 50 cars before we even opened the sort of check distribution process. And so it shows just how important this is and how powerful it is to the folks who can receive them. Now, I want to mention that the council ordinance that established this had very narrow rules in terms of how we could use the funding. So we've got a lot of questions about, like, do I can I qualify, et cetera, et cetera. Short answer is call 311 or go to cabq.gov/economic development for this info. Now, some good news. Last night, Council did relax some of those restrictions. So we're going to be a little bit more flexible, and we'll have an update for you later in the week on how that's going to work. But the final and third round of applications is open all the way through to December 7th. So there's still time to apply for these funds. So we're talking about it today to make sure that folks do reach out and try and apply for those dollars. Now, let's talk a little bit about Metro Albuquerque. So we all know where we're at as a state and so forth. We always like to give a little bit of an update on the city. And we're going to use some PowerPoints for this. So I want to turn your attention to the first graph here that you see on my left. Recall, we've been sharing with you periodically, how our city is doing compared to other cities. And our Dr. Mark Domena is going to talk about how the Metro is doing compared to other areas in New Mexico. But in terms of regionally, throughout the spring and summer, Albuquerque really stood apart from cities like Phoenix and Denver and Austin. And really, we were a role model, actually, in many ways for wearing masks, for social distancing, staying at home. And look, we know we have our challenges. It's not saying that at all. But relative to these other cities, we did a very good job. And that is a good thing. That's something we need to remember because we got to keep doing it. And this graph really demonstrates that. So you can see some very early success. So Albuquerque Metro right here is this lower line. This is the number of positive cases per capita. Again, the key being per capita. So this is comparable data. And you can see here that we've been the lowest. So once we got into the summer, we were always lower. And look at this huge gap. All these other cities, Denver, Salt Lake, Austin, all these other cities going way up, us really holding steady. Then you see right in October, we start going up as well. Okay, now we did a great job in the summer. We proved this is one of the healthiest places in the Southwest to live. And now that these numbers aren't looking quite as good. So the reality is you can see now we're just a little bit below Austin and Tucson. And so, frankly, those cities have done a much more steady job. You've got to give them credit for that. And then, we haven't done as good of a job, and our numbers are increasing. But I also want to share the rest of these cities, right? There's a handful of cities on this list. In fact, I think there's 9 or 10. But, we are still doing just way, way better than Denver, than Reno. You can see these statistics up here, obviously, than El Paso and Salt Lake. So again, it doesn't really matter because all the cities are not doing good, right? All these cities have challenges, so that's abundantly clear. But I also get a lot of questions all the time. Well, what about El Paso? What about Austin? And so that's why I want to share this data with you. Okay, now let's look at the next slide, which speaks to this in a little bit more detail, but I think similarly to these issues. So look at the Albuquerque Metro right here. These are some key metrics. This is the number of confirmed cases, the total tests, and then deaths, and then our percent positive rate. Now, if you look at Albuquerque Metro, these are the worst numbers we've seen ever. So we want to be clear, this is why this reset is so important. This is why we have to be very, very vigilant with everything that we're doing. But it's also important to remember, right, this is an American city problem. And if you look at all these other cities, again, Denver, Tucson, Austin, Phoenix, Salt Lake, El Paso, you can see that in almost every category, we are still the best in the region. And so you look at positivity rate, you can see us at 8.9. We are the only one of all these cities under 10. We're also, deaths, again, Salt Lake actually doing pretty good in terms of that rate, but other than that, we're twice as good as the cities around us. Total tested. This is a credit really to the state, to the Department of Health and the work they're doing, and to all those who are doing testing in our health community and our hospitals. Look at the number, and again, this is per capita, the number of folks who are tested. We have double, if not 3 times, the percentage tested than these other cities. And so this is a very good thing. It shows that I want to live in Albuquerque more than any of these other cities in general, but especially during a pandemic. And so continue to get testing. That's very important. But we are doing a very good job in the metro on that. Now, confirmed cases, again, this is the worst number we've seen since we started. However, compared to other cities, we're still in very good shape. In fact, we are still the best on this list in terms of confirmed cases, right? And you saw that on the previous graph. So that's a little about where we're at. Again, a reminder, all of these cities are in the worst place they've been, including Albuquerque. So that's the most important thing. But I also just want to dispel any myths or rumors about, oh, Denver's doing X, Y, and Z, and Phoenix is doing this and that. Look, Albuquerque, New Mexico right now is a healthier place to live, and that's a good thing. And so I'm grateful to everyone who's a part of that, especially this testing number. So really appreciate the state, the governor. Look, we should all be very grateful to have Governor Michelle Lujan Grisham right now because of this number right here, in addition to the others. And so also in the Albuquerque metro area, our hospital system, we know that there's capacity issues and so forth, but everyone who's doing testing, again, we have 3 times the tested population that most of the other cities have, and that can only be a good thing for us down the road. Now, let's talk a little bit more about some specifics with respect to enforcement, because that is also helping these numbers compared to other cities. I know we've had our enforcement challenges, but I will tell you that, again, on a relative basis compared to other cities, we've actually been doing, I think, a yeoman's job when it comes to enforcement. We are trying very hard. You can't enforce your way out of COVID, but we know that it helps, and that's why we're going to keep doing it. So there's been some challenges, as you would expect, with the new health order, and we want to walk through some of the details with respect to that and also clarify a few things. So with that, we'll hand it over to our Fire Marshal, Gene Gallegos.
Mr. Mayor, thank you very much, and thank you for everybody joining us. Updates with for the public health order compliance team. This weekend, we did go out and visit all as many large box stores on Saturday and on Sunday as we could. So we hit approximately 80 different locations. Our main focus was on ensuring that businesses were limiting the amount of essential items that could be purchased, just to help prevent hoarding, anything like that. We were making sure that retail businesses like hardware stores, grocery stores were observing special rules for our seniors and high-risk population. We found that in general, most of them were complying with the existing public health order for the hours and limited purchases for those essential items. There was a couple that were still working through the logistics of hours and days that those special high-risk population would be utilizing their facilities. That has all been taken care of, and so now everybody is in compliance. We were also out there answering questions on the new public health order. We clarified on services for houses of worship. There's no limitation for vehicles for outdoor services. So drive-up services are okay to have for any type of house of worship services. Large retail can operate following 25% capacity or 75 customers, whichever one is smaller. Businesses that are not essential businesses may operate to the minimum extent necessary to provide curbside pickup or delivery services. Now, again, over the last 7 days, the team has had over 277 compliance interactions with businesses or individuals. We've over the month of October, since the month of October, we've had over 3,000 compliance interactions. This week, we will be going out and visiting all non-essential businesses to advise them on the new public health order, if they are open and not supposed to be, and only doing curbside. We will continue to do spot checks throughout the week on all business types to ensure compliance of the public health order. The team will continue to send out members to 311 concerns to investigate, ensure compliance, and to issue notices of violation if it is necessary. So thank you very much. I'll now turn it over to Dr. Deputy Director Mark Domena from Environmental Health.
Thank you, Deputy Chief. First off, I'm going to talk a little bit about some of the closures in the city. As Mayor mentioned, we are very much holding ourselves to the same standard and following the same requirements that we're going to talk about for everybody else. The governor has rolled out, absolutely in the interest of public health across the board, and particularly for city employees. The key thing for city government for us, and this has been an issue throughout this time since March, is that there are critical services that the city has to continue to offer. And every effort is going to continue to be made that those services are provided regardless of what other restrictions have to go into place. 311 will continue to be open during its regular hours. We encourage people to use the One Albuquerque app if for some reason you're outside of those hours. A lot of public access to buildings is going to be closed for at least the foreseeable future. That includes police substations in most city buildings, the city clerk's office. Also includes most cultural services facilities, so the biopark, the libraries, the museums, the South Broadway Cultural Center, the Chemo Theater. Those are all going to be closed throughout this time. For the film office and small business offices, those are closed for in-person, but you can actually still call or make an appointment to deal with them online. One of the critical issues, the community centers are largely going to be closed for most uses, but the child care programs that have been going on for essential workers will continue. That's absolutely a requirement that we've had since the beginning in order to make sure that those people that need to be at work, serving the public, looking out for public health and safety can continue to do that while schools are closed. The WEC and which is the West Side Shelter and the Health and Social Service Centers continue to be open. Most of the parks facilities, especially places that require like a sign-in, like golf courses or the shooting range, skate parks, tennis courts, pickleball courts, the open space visitor center, those are all closed. But trails and open space continue to be open. I'll mention this again, but we definitely encourage people to make use of those as a pastime if you do have to be out. Planning services can be done by appointment. Animal welfare for adoptions, that can be done by appointment. There will continue to be solid waste convenience centers are open and regular trash collection, and the transit services will continue to run, although those will be shifting to a new schedule soon, so I encourage people to kind of keep up with those changes. All of the information that I just ran through quickly there is available in lots more detail on our website or by calling 311. So we encourage people to take advantage of whatever they need to and make sure that they plan ahead for what closures may be in place. To talk a little bit about where we're at, and Mayor provided a good overview on this already. Bernalillo County saw almost just under 2,700 new cases, 2,694 new cases last week. That was 1,000 more cases, give or take, from the week before. So the rate of new cases is continuing to accelerate, which means that curve is just continuing to go up and up. And we're just building off of a higher and higher level of cases each week as we go. And that's why we're talking about this crisis that we're talking about. That's why these things have to be closed. That's why behaviors have to change for the foreseeable future. At the same time, the positivity rate for testing is very high. It's roughly 10% for Bernalillo County over the last week or so, and that is very problematic. And if you've been paying attention to what the state has been saying, what Dr. Scrace has been saying, a lot of the testing that's being done, while the numbers are really high, those are responsive tests to people that need to be tested because they've probably been exposed, been around someone who's positive, they're showing symptoms, they're sick. These aren't even just the surveillance tests that were being done early in the summer. So you would expect a higher positivity rate, but with a very large number of tests like that and a lot of people needing to be tested, that's very indicative of what kind of trouble we're actually in right now. The spread rate for the metro area was most recently indicated at 1.16, which is just a little bit up from 1.07. If you've been tracking that number throughout this time, throughout the summer, that's actually not a very high sounding spread rate. 1.15 was the original gating criteria back in midsummer. But that rate indicates the number of new cases that each case infects. So even for 1.16, but you're building off of 1,000 or 1,200 cases a day, it doesn't have to be that high in order for us to just be in this logarithmic growth, this very, very high rate of growth for new cases that is far beyond what the hospitals can handle. And the new case counts, the most recent per 100,000 per capita is at 43.5, and that's already up from 34.5 the week before. The number that the state is looking for is 8 cases per 100,000, so we're very close to 5 times what the gating criteria would allow for. And all of this data, if you're not really into numbers, is saying the exact same thing over and over. It's absolutely critical that people stay home. That's not stay home until you've got someplace you want to go. That's not stay home, but unless you want to go out and you'll put on a mask or stay 6 feet away from people. We're not talking about looking for ways to continue to do things normally. It's truly about staying home. The reason that there's another round of closures and we're back to where we were so early in this is because as things reopen, people were taking advantage of them very cavalierly. There was a lot of complacency that had come into place where people just felt like, I'm wearing a mask, so it's safe for me to go do the things I just feel like I want to do. This is like sitting in front of a toasty fire and, forgetting that when you open the door, it's still going to be blasting winter cold outside. Nothing about the virus, nothing about the pandemic has changed. We continue to be at a very high risk. So when we get complacent and we forget about those things, get up, try to go outside and do things that don't need to be done, we're putting everybody else at risk. It's probably worth revisiting some of the things that we really would encourage people to do. Use virtual tools to socialize with people if you can't be in person with them. Absolutely make use of the grocery pickup services. If you haven't tried these services, they're fantastic. I mean, you just sit in your car and they bring everything you've ordered out to you. It's too bad it took a pandemic for things to be that easy, but it's a very convenient service. It very much allows you to live the life you're used to living. There's no reason to be in those stores, and it has a huge impact on how much risk we don't have to take on. For people that are going to be in close contact with someone that is testing positive or may have like a test result, that's an especially important time to stay home, not go out in public, not risk exposing other people if you may have been exposed yourself or if you think there's a chance you're infectious. Similarly, if you're awaiting your own test result, don't go anywhere. Stay away. If you're at home and you live with other people, try to stay to one room by yourself and avoid infecting other people. We have to do everything we can to try to avoid infecting other people and increasing these cases. And each case is adding more cases as we go. And you have to think about in terms of the people that you live with, that you love, you really want to be the one that got the whole household sick, especially if somebody gets very sick and ends up in the hospital or dead because of it. So just taking those precautions very, very seriously. It's less of an issue as more things get closed, but some of us, I'm in my office, some of us are still coming to work. Don't come to work if you're sick. If you think you have symptoms that are consistent with COVID, which is a wide range of symptoms, and encourage people to review what those are, don't go to work. Don't take any chances. Don't be the person that gets everyone that you work with sick, and don't spread COVID any further. Just briefly to talk about Thanksgiving, because we all know it's right around the corner. Some people's stomachs are probably already growling for it. It's really hard to get our heads around this, but the idea this year is like there's really no reason to take the risk of having Thanksgiving with people outside of your own household. It is absolutely critical to understand the damage that can be done. Look at the news stories. It's not just one isolated random case. There are story after story of people trying to have these events like nothing's going on, getting their entire family sick, and then some loved ones aren't going to be around the next year. So think about the people you had Thanksgiving with last year. Think about whether or not you still want to be able to have Thanksgiving with them this year, and just put it on pause this year. For people that are in your immediate household, you're around with every day anyway. Obviously, have dinner, give thanks, enjoy the holiday. For other people, visit virtually so that they're still around through Christmas and they're still around next year. This is absolutely a life or death kind of decision that we're talking about. And it doesn't make sense to continue to put people at risk just to try to have that shred of normalcy. And we know the news has been fantastic the last couple of weeks with a couple of vaccines that are far more promising than anybody had hoped for. And that might be something for us really to look forward to down the road. But read the rest of the story as well. That vaccine is not going to be widely available to people until next spring, maybe even summer. There are logistical issues with getting vaccine to billions of people around the world, or even tens and hundreds of millions of people in our own country. So it's not the panacea that we're just hoping for, and it's going to be here by Christmas time and everything's going to go back to normal with the snap of fingers. We have to continue to do the things that we do, to take precautions, to be careful, to be safe, until we get to that point where the vaccine is widely distributed and it actually has made a difference. And then hope that that's what's going to kind of deliver us on the other end of this. But it's not a signal to just kind of throw up our hands and say things are almost back to normal. We've almost finished this off. We're not rounding any turn yet. There's a home stretch, but it's a long home stretch that we have to get through. So please continue to take this seriously, take precautions. Hear what the hospitals are saying. With the level of being filled that they are and the exhaustion that those healthcare workers are suffering from, they want to see Thanksgiving with their families. They want to see the holidays and next year and the future with their families as well. They're right at the front lines, very much at risk, and they're working their fingers to the bone trying to take care of hundreds of people coming into the hospital at a time. So it may not be you that you're worried about. If you feel like you're healthy, it's not going to be a big impact to you. That's fine, but you have to understand your role in the entire community. The more cases that we have, the more restrictions that we'll have, the more transmission there is, and the people that aren't going to just be okay, that are going to end up in the hospital, are going to continue to be at risk. So we're putting the hospital workers at risk, we're putting our hospital system at risk, we're putting people we don't even know at risk. It's a time where everybody has to make a sacrifice to look out for each other. do the compassionate thing. Think about all of the people that can be impacted if you're careless, if you make a selfish decision, especially going into the holidays. So, I hope that's something to think about. The numbers continue to put a lot of pressure on us. The situation continues to be, and the metro area is, no exception for that. We see it around the country. So that's my appeal. Next up is going to be the director of the Family and Community Services Department, Carol Pierce, to talk about COVID prevention for those on the streets and working with nonprofit organizations. Thanks.
Thank you, Deputy DeMena, very much for your wise words. Here at the Department of Family and Community Services, we're just very grateful for all the partnership we've had in the community with our community partners, with the state of New Mexico, with UNM. And to date, we've spent a little over $4 million to make sure that a safety net is in place for our community's most vulnerable people, and that is our people that do not have homes. So right now I want to highlight some of the work that we've been doing. So since March, all of our partners, we've been coming together on a daily phone call. Depending on what's happening with the pandemic, sometimes that daily phone call is 7 days a week. And what that phone call allows us to do is to adjust, to respond, to know what the numbers are looking like so we can take the best precautions possible and to adjust when needed. So what we've been doing at our West Side Emergency Housing Center since the pandemic, it has been open 24/7. That is part of that large cost that I mentioned earlier. With that opening of 24/7, we are serving 3 meals a day, and we still have transportation costs if people need to come back to town for appointments. Sometimes people wonder, if you are homeless and you're at the shelter, why would you need to come back to town? A lot of people need to come back in for medication, for doctor's appointments, and many people do have jobs. They just don't have the financial means to have a home. So at our West Side Emergency Housing Center, we do require mask wearing, except when people are sleeping or eating. We have distanced the beds in the pods. We do not have people sleeping on upper bunks, and we are complying with the 6-foot distance. And we have many posters that we've added to the West Side just to remind people of the importance of following these precautions. So in addition, we now have 4 hotels that the city is operating in partnership, one in partnership with the state. 2 of these hotels are for people who are unhoused and who are COVID positive. And currently, as of this morning, we have about 61 people in between those 2 hotels and capacity to receive more. On a daily basis, we look at that census and then also keep people moving through once they are well and able to be back at the WEC. We also do have, with our 2 hotels, are what we call the wellness hotels. Between the wellness hotels and the WEC, we are housing about 516 people. So the concept behind the wellness hotel was to reduce the density at the West Side Emergency Housing Center so we could maintain the 6 feet, we could have fewer people, and people who were older, who have chronic health conditions, were moved into the wellness hotels. We are also keeping families at one of the wellness hotels, and we no longer have a family pod out at the West Side. And we did that in part so those youth that need Wi-Fi to comply with, keep up their schoolwork, that was easier at the wellness hotel. And I want to say with the wellness hotel, our main goal, as it is always with people who are unhoused, is to get them the services they need, the support they need to ultimately be in the kind of housing that best meets their needs. So I just want to say I'm very, very proud of Albuquerque. I'm very proud of New Mexico. Across the nation, many people who are caring for those most vulnerable have not seen the kind of results we've had. Now, I will say we did have a COVID outbreak at our West Side, and we managed that, and now we're back into a steady state. And that wasn't surprising. That can happen, but we've done so much better than our colleagues across the country. And I really credit that to the partnership among all of our colleagues here in Albuquerque. To also highlight another partnership that I'm very proud of is with the Bernalillo County Community Health Council. Now, this is a very important group of individuals made of nonprofits, of neighborhood groups, and health providers, and they're working with us to spread out gloves, masks, and hand sanitizer in our community. And I'd really like to highlight that what they've got is about 1,500 gloves, 1,500 masks, and about 1,000 small bottles of hand sanitizer that was donated by Sombra Professional Therapeutics, and that hand sanitizer is from here locally. This is a great partnership to get those protective pieces that we know we need to mask, we need to hand wash, we need to use hand sanitizer to really get this out in the community. So I'm very, very proud of that partnership. And part of this is to really complement that work that we're doing with small businesses as well on protective gear as well. So it's really my pleasure to introduce Enrique Cardiel. He is the Executive Director of the Bernalillo County Health Council. Enrique.
Great introduction, Carolyn. So the Bernalillo County Community Health Council has a harm reduction working group that meets with different harm reduction organizations across the county. And we have had the opportunity to partner with the city in order to distribute this protective equipment to folks who are doing outreach. So we are currently checking in with our partners. We will start distributing equipment this week that we received. We will get gloves, masks, and the sanitizer that Carol Pierce had talked about out to folks, hopefully starting tomorrow or Thursday. This will go to folks who go out and interact with folks who may be living outside, our neighbors that don't have addresses, reaching out to those folks, folks who may be dealing with substance use issues and other issues. And also some of the PPE will be given to those folks as well to help them stay safe. We know that for a variety of reasons, not everyone will go to a shelter. And so we're doing our best to reduce the spread outside of the shelters with folks who may be moved around. We know that people, for a variety of reasons, are uncomfortable with folks sleeping in the same place outside for extended periods of time. And so we need to provide some support in those folks being safer. And so it's a great partnership for us to be able to step up and support the mission, the overlap in the missions of the city and the Health Council to keep people healthy and keep people safe. And really ultimately keeping our neighbors who don't have addresses healthy and safe will keep everybody else safe, right? Because they interact with the rest of us, we interact with them for a variety of reasons, whether it's something positive, is people who reach out and try to support folks. There are folks who go out and give out blankets and those kind of things this time of year, jackets, that are doing it as a volunteer, not necessarily through a nonprofit or government agency, right? So the less outbreak there is amongst folks living outside, the less chance that will be passed on. And hopefully folks that volunteering to do this kind of work are taking all their precautions so they're not accidentally spreading anything to folks. So yeah, we're looking forward to this. We know this is a start, that the pandemic will last for a long time, even with the vaccine. If we're lucky, summer will start to move around more, but it may be possible that even with the vaccine, it may take a while before things are at a place where people can feel comfortable moving around and interacting with other folks. So I think it's important that we develop good routines and good support systems. And so we're greatly appreciative to be able to support the city's mission in that way, because it so much coincides with our mission. Thank you.
Thank you so much to our speakers, and love that background, Enrique. So, summer breeze on the beach. Sounds a little far away right now. Anyway, let's see. I think we're going to take questions from folks. So, Maya, go ahead.
I don't have any questions at the moment.
Any questions in person?
I just wanted to ask about the businesses. How many businesses are getting the money, or does it depend on the amount?
Sure. So the question is about the businesses, and remember there's a couple of programs. One is for PPE. If you need help with PPE, basically contact, there's about a dozen chambers of commerce and other groups like the one you just heard from who can get businesses PPE. So call 311 and ask if you need that. And in terms of the $10,000 grants, we've handed out 97 so far, so there's still hundreds left to go. And basically, just again, call 311 or check cabq.gov/economic development for information.
And it's till December 7th, right?
Yes,
Okay.
they're taking applications until then. There are some criteria, so it's not automatic.
The next one starts December 7th.
Oh, the next one starts.
Yes.
Okay, thank you.
All right. Okay. I think with that, we will see everyone next week, if not sooner. Thank you. Oh, hold on.
Just got one more payment from Jessica Dyer at the Journal, and she wants to know what the total number of cases tied to the WEC outbreak were.
Okay. This question is probably best for Carol Pierce, so I'm going to tee her up. And the question is, what are the sort of total number of cases or most recent batch of cases at the West Side Shelter? And as a reminder, now we're using 4 hotels to distribute folks. And so a very strong protocol and procedure effort by Dr. Parajon and Carol Pierce. So if we can get Carol on here, we'll try and answer that. If not, we'll follow up. Carol, go ahead. We do have some other questions, so we'll be here.
Okay, thank you, Mayor. I wasn't on the daily call this morning with our partners, but as I mentioned, at our current COVID hotels, we've got about a total of 61 folks who are COVID positive. Not all these folks are from the WEC. We are serving that as the safety net for all of our partners here in the community that are serving people without addresses. I like how Enrique described that. On a daily basis, when we're talking at the WEC, we might have a one case or two, but to give you an exact number as of today, I can let you know. But when we have our daily call, it's been very few, if any.
Okay. So thanks so much for that, Carol. And again, great job containing that outbreak. We're in a much, much better place right now. Let's see, I think we have a few other questions.
Yep, I have one question from KRQE. They say that we saw this weekend a number of people were rushing to panic buy. So Mayor, you tweeted about helping to make sure that people got what they needed, and what's being done to make sure the elders are being taken care of and enforcing special hours.
Yes, the question is about special hours for our grocery stores and big box stores, and what we've been doing about it, especially with respect to the rush that happened this weekend at grocery stores. This was something that we worked on proactively last week to get everyone ready for this and remind them that under the health orders, city and state, you have to have special hours for vulnerable populations, including seniors. And so our fire marshal's team did a great job prepping everyone for that. And almost every big box place has those hours posted on a website and at their facility. Now, there were a couple of stragglers, and as of yesterday, there were a couple of home improvement stores that I think, and your sort of larger discount grocers, that as of yesterday said very shortly they would be in compliance. So we'll make sure they are. So that should all be in place for this coming weekend.
All right, one more question from Steve at KOB. Says, I know the city has earmarked $10 million for small businesses. Could the city set aside more in the future?
So the question is, we put aside $10 million for small businesses, and that's actually on top of about 2.5 in other types of business support we did over the summer. And the question is, could we set aside more? And here's the thing: our CARES money runs out the end of December. So the challenge is, the city also doesn't have flush cash in our coffers. So I think it's going to be very hard for the city to do more unless there's another stimulus package, either from the state, which may happen if there's a special session, or from the federal government, which I know there's a lot of talk about that pending presidential politics. So the answer is we would love to, but the state, we have to spend all our CARES money by the end of the year, and it's basically already budgeted for and going out the door. So there's not a lot left, at least in the near term. Okay, thanks, folks. Stay healthy and safe, and we'll see you next week.